I have the great pleasure to introduce Dr. José Flores-Sevilla, Pepe. So in Finland, we have a licorice, a salted licorice, and the nickname is called Pepe. So, and that licorice is actually made in this city. So we will bring some later on today. But Dr. Sevilla is a scientific liaison officer residing in Tijuana, Mexico. He is a biomedical scientist with extensive international research experience, specializing in immune cell differentiation and inflammation. He combines advanced diagnostic skills with translational expertise in chronic diseases and cellular therapy development. I have the pleasure of announcing his title. It's The Silent Epidemic, Data-Driven Approaches to Diagnosing Chronic Tick-Borne Infections in the Mexican Perspective. Cheers.
Thank you. Thank you very much. Good afternoon, everybody. First of all, I have to say this is a pleasure. This is an honor for me to be here speaking in front of you. And as Dr. Jyväskylä just said, I'm going to try to take you to a trip to Mexico, a trip which is a story of a neglected epidemic that is going over there. And it is not a story of absence, but it is a story of invisibility. First, I want to say that there is no conflict of interest for this presentation. And for the end of the session, I would love all of us to recognize some things about the Mexican situation, such as recognize ecological and clinical evidence of chronic tick-borne infections over there in my country, understand the potential of multiplex serological tools and ISO-aligned pipelines to improve diagnosis, and of course, explore how integrating geospatial mapping and community surveillance can strengthen patient outcomes and public health strategies. Well, vector-borne diseases are neglected all over America, but they are a growing public problem. We know, we have heard all about vectors since pre-Hispanic cultures. We know very well about mosquitoes. In fact, we hear a lot about arbovirus such as dengue, chikungunya, Zika. All of these are transmitted by, mainly by Aedes aegypti, the mosquito, which is very popular and which has all the attention on the research over there, not only in Mexico, but in most parts of Latin America. But underneath this noise, there is a growing evidence on some other tick-borne diseases, such as rickettsiosis. Nevertheless, if you look at what does the government say and what does the manual say, you cannot find very much about it. You just find very few cases. I'm sorry, this looks pretty bad. But as I told you, the most popular vector-borne infections that we hear are that we listen from are from these arboviruses, such as dengue, Zika, chikungunya, and rickettsiosis is just seen as an emergent infection or an emergent problem, which I would love to provide some evidence that it is not emerging. It is over there, and it is a very, very common problem. So the problem is that, but why do we don't know very much about garrapatas? Garrapata is the Spanish word for ticks. Are they not popular over there in Mexico? Of course they are. We have a lot, and we have several communities and a lot of knowledge about them since pre-Hispanic cultures. If anybody wants to practice their languages skills, here are some words from different pre-Hispanic cultures for garrapatas. In fact, if you wanted to know how common they are, we have a lot of places over there in the country that could be considered as endemic region, even if we don't know, because we have places in all over the country that resemble, for example, in the southern state of Guerrero, this is a southern state just in the Pacific, there is a town that is called Garrapata, such as it, tick. In the very center of the country, there is a turicato, which also means the same, but in the local language. Something very interesting is that just a complete state of Mexico, in the southern part of Mexico, if anybody is familiar with the Riviera Maya, Cancun and all over there, which is very popular for tourism. The state just besides Quintana Roo, where Cancun is situated, it is called Campeche, which in the local language means snake tick or garrapata de serpiente. On the other hand, in the northern states, we have Sinaloa, which it's a very popular state right now, if anybody is aware of criminal organization and some things like that. There is an island over there called Garrapata Island. So are they common? Well, it seems to be that we have a lot of them. And in fact, we have a lot of them. Let's have a glimpse on how biodiversity is over there in Mexico. For the year 2000, we have reported 78 species of these ticks. 20 years later, we have already identified 109 species, which represents 10% of global diversity. This is amazing. This is very important because in such a region as Mexico, which could represent just the 1% of the global territory populated by us, just in the 1% of this territory, we can have more than 10% of the biodiversity of these animals, of these vectors. But we don't know pretty much, we don't know nothing. We know nothing basically on tick-borne diseases. The most common one over there, and the one that is being called as emergent, is rickettsiosis. And we have several myths, like a geographical myth. One of these geographical myths, and which is very popular and which is very deep into our culture, is that rickettsiosis, it's only in the northern part of the country, was near to USA. And we have recognized rickettsiosis since the 1940s. Maybe this knowledge or this myth was enriched or fed by the legend of Dr. Ricketts, who was a very well-known expert on spirochetes and who was studying, who knew everything about Rocky Mountain spotted fever, Rocky Mountain fever, the pathogens, and who came to Mexico, and while a typhus epidemic was going on, and who died over there while purifying the agent. So he became kind of a legend, and everybody now knows and says that rickettsia is just only from the northern part of Mexico. Nevertheless, we have lots of evidence every day growing. Well, not a lot of that, but we have evidence and growing evidence and robust evidence that have shown that there is rickettsia all over the country, even in the most southern part of them, where a fatal case was reported and got very popular, let's say, in the news, where a girl was diagnosed post-mortem with the infectious pathogen with rickettsia. So rickettsia it's not just over there in the north, there's all over the country. In fact, there are several publications, at least we could find 11 papers at the very beginning of this year that could report that in 31 of the 32 states, we have recognition, molecular recognition of this pathogen. So that's completely a myth, sorry. And most important, very important and very impactful data is that more than 20% of patients are positive cases for rickettsia. But we don't know very much about his friends, because now I'm sure that everybody here is familiar, and everybody here knows that normally when a tick bites and gives you an infection, there's no one pathogen. Normally it comes with a lot of friends, but we don't know anything, and we don't have any information about the co-infections of this. What's going on? What's happening? Well, we have some reports, and we have been identifying cases all over the country. Nevertheless, if you see the published data, since 1939 till 2020, there were only 400 cases reported of borreliosis. This is a very huge gap. We are still in the darkness. We have identified several species of Borrelia, all of them, and they are not only identified as infectious in serology. I mean, we have identified them also in ticks all over the country. We have molecular, Gordillo Perez has reported lots of infections in ticks all over the country. By immunofluorescence and by PCR, we can identify genetically and molecularly this pathogen all over there. In fact, there are now good data that there's good data that Borrelia in ticks, you can find it all over the country, and this is kind of logical, and this is kind of very straightforward. And not only in ticks, but also in patients in Mexican population, you can identify it all over the country, in all over the states. So we know some things about this. We know some things about the ticks, some things about Borrelia, but we have no data on serological or serological experience. Recently, a worldwide review has shown that Mexico is one of the biggest, has one of the biggest problems with serological. Well, serological data were more than, where we could find not only ICSODs, not only the infection in the animals, but also serologically, we can find more than 20% of, it's here, 22% of patients are positive for Borrelia in Mexico. On the other tick-borne diseases, on the other pathogens, basically we don't know pretty much. We have only 4 papers published for relapsing fever. Human babesiosis is just in the darkness. We don't know anything about it. We have heard a little bit of that recently. Anaplasma, we have some data, but we still don't know very much how they are evolving or what's happening in our population. And in summary, we have a lot of information about its presence all around the country, and it's very interesting that more than 20% of serological evidence that patients have serological evidence for Borrelia burgdorferi. But why are we still in the darkness? Which is the problem? It's a problem that clinicians or healthcare providers do not follow the guidelines. Why is it that we don't understand and we don't know pretty much about that? Is it that we are not, as I said, following? Well, we have some guidelines. They are not very glamorous, but effective for remaining in the darkness, because this is what you can find only here in Mexico. This is the report. This is the guidelines to do what to do. I'm not going to go over there through that, but the standard is an IFI, an indirect immunofluorescence, which you as a healthcare provider should execute around during the 14 first days of infection, and only if the person dies, you can determine by PCR the species, which species of Rickettsia or Borrelia. Well, actually, this is just for Rickettsia. We don't have any guidelines for any other tick-borne disease. So maybe the problem is not, well, the problem is here. It's very, very, very clear. And this brings us some calls to action, which we're trying to get, because every time and every day we're having more and more news of kids, children dying from these infections, and normally we don't know how to respond. We don't know even how to diagnose it. So we're trying to bridge. We want to bridge this gap. We want to go from signals to solutions and to build reproducible pipelines for this diagnosis. As I tried to tell you, Mexico's official surveillance shows clear signals of rickettsial infections, but we don't have typification, and partial sampling hides. It's hiding. This silent epidemic in Mexico is not a lack of cases; it is a lack of clarity. This is very straightforward. And surveillance is just focused on rickettsioses, and we're not doing pretty much about it. So what are we doing with this calls of action? Well, we have been gathering some efforts with a really amazing team over there in Mexico. And we are just launching a project which is called Looking for Borrelia and Rickettsia over there in Baja California. And we are gathering the effort of this fantastic company that we are all familiar with. Another Mexican company, which is Labo Medici, is a provider of some laboratory equipment and research issues, and this Institute for Research. We're generating this laboratory for diagnosis of these tick-borne diseases. And we're trying to improve detection of chronic tick-borne infections over there in the country, in the region of Baja California, starting over there, starting just in the northern part, and trying to show that this is not a rickettsia problem only, that we have so many other problems with tick-borne diseases. We're trying to evaluate the performance of advanced multiplex assays under local field conditions, and to develop a replicable diagnostic pipeline that integrates ISO standards. This is very important. ISO standards are just gold, because as all of us know, these infections and this sickness are very, very controversial. So we're trying to do it in the right way through the standard, international standards. We are aiming to have some implications for the 3 levels or the 3 dimensions. In the scientific level, we want to show region-specific data and reproducible quality assurance model. In the clinical level, we want to improve diagnostic confidence and earlier case recognition. And in the public health, we want to generate collaborations, cross-border collaborations, and scalable surveillance, fortunately, all over Latin America. But this reading it's about showing data. And for that, we have this heart. The heart of this is Tick-Plex. I'm sure that most of you are familiar with that, and it is an enzyme-linked immunosorbent assay, or ELISA, which is and it has very, very particular and very useful characteristics, such as it allows us to recognize not only the co-infections, but also the chronic infections, which nobody else can do. And Tick-Plex has proven, and we have several data in literature, published data that shows that it is very useful to recognize acute phases of the infection and also the chronic phases of infection. So that's why it is getting very useful, and it is just the heart of our project. And besides, it has shown very good correlation with several other strategies over there in the market, and that it can aid to replace the need for several diagnoses and several strategies for diagnosis. But as I said, the conference goes about data, and I want to show you some data. As I told you, we are just launching this program over there in Mexico. We're trying to figure out how serological evidence is in the patients over there. And we have started with 7 patients, which are 3 patients, you can see in the start, which are 3 patients that had recent febrile symptoms, and that one was confirmed with a tick bite, and 4 other asymptomatic volunteers, but that were surely exposed to ticks previously, but nevertheless they don't have the symptoms. This is very dramatic, and this is very interesting, because the first one is the one that is confirmed tick bite, has a confirmed tick bite, and we could see that in IgM, all of them are positive. This one is very interesting, and it gives some strength to the test, because it is clear, it is negative for all IgM, or the pathogens that the test can not only determine, but also measure the amount of antibodies that they have in circulation. And it's interesting that these volunteers that are asymptomatic, they also have a lot of representation on IgM. It's very, very hard, it's very strong to see this, but I have to tell you that these samples have been tested at least 3 times, twice in Mexico, and we send the samples over here for the group in Finland, and this is the results. The results are just the same, and this is for IgG. It's very it's kind of hard to see, because if we look at the IgM with these patients, we have around 40 to 50% of universal positives, which something very interesting that surely we're going to learn more about that tomorrow. And when you see the IgG late in the chronic stages of the infections, around 70 to 80% of this population, this small population that we have just analyzed, is positive for most of them. So this is why we are starting with this project, and this is why we're trying to look further what's going on with patients, because there are lots over there that are not being diagnosed. And we hope we have some impact for the patient. We hope that we can generate more access to validated diagnostics, reduce misdiagnosis and earlier treatment, enhance earlier treatment, sorry. And for health providers, we're trying to enhance diagnostic certainty and integration into primary care. For the scientists, we want to generate a reproducible ISO-aligned model for neglected chronic tick-borne diseases over there in the country, which, as you saw, we are just in the darkness. So conclusions, chronic tick-borne infections in Mexico are not invisible. They are just underdiagnosed. And through ISO-aligned diagnostics, geospatial epidemiology, and patient-centered strategies, we can transform this silent epidemic into an opportunity for scientific and clinical leadership in Latin America. That's pretty much it. Thank you very much. And
Thank you, Jose, for a wonderful presentation.
Thank you.
Wondering from a clinician standpoint, maybe you don't know that you're still kind of for it, but is there any room for clinical diagnosis in that algorithm that you presented where, and maybe I just didn't see the bottom of it, but like the serologic diagnosis versus like seeing a patient that has symptoms, much like mine, should be, you know, in some cases, a clinical diagnosis and treatment early to avoid complications and fatality, especially for rickettsia and especially in children. Is there any room for clinical treatment without this serology in any of the guidelines?
No, honestly, there's not. And as you could see, that the guidelines are very simple. They just tell you to use serological immunofluorescence, and then if it goes positive, you can go to PCR, which is kind of complicated to get a good result over there, because you're not going to find any of these bugs over there in circulation. So yeah, on the side of treatment, being honest, we don't have so much information. I should look at the clinical guidelines, but this is just for diagnosis. This is just what we have over there.
The antibody production you need, what would be the seroconversion rate for tick flags?
I'm not really sure about that. Yeah, sorry. Yes, of course. Yeah, I tried to show it, but I didn't went deep on it. But it's been proved that Tick-Plex is very useful for separating these stages of the infections. The group over here has shown that with pre-characterized samples, you can determine. It has been determined that the amount of IgM is correlated with the early infections, while the amounts of IgG are normally correlated with chronic infections. That's what we are trying to use it and to change the narrative over there in Mexico for the diagnosis of all of these problems.
Given that you require the presence of antibodies to entry or a diagnosis, be missing individuals who may be immune deficient.
Yes, of course. Yes, of course. That's a very important point over there. Yeah.
I just wanted to clarify it as a Mexican physician. The hope is the guidelines, the clinical guidelines, the government allows you to start treatment just with clinical suspicion. So that's why a lot of the cases are missed as well, because as long as the patient kind of feels or has the diagnostic criteria, you can start treatment.
Thank you for the presentation.
Thank you.
Thanks. I didn't realize you had so many tick species there. My goodness. So just a comment here, and just to reemphasize your point of the data that you presented, 23.1% of the individuals have a Borrelia serology, positive serology. That's amazing because the global study that was done by DeLong is 14.2%.
Yeah, it's amazing. It's very impactful. It has a huge impact when you see that. And over there, we are just neglecting it. We don't know anything about that. So, yeah.
I'm happy to speak, if that's Richard Schloeffel here from Australia. The question is, with Tick-Plex, do you think it indicates you've got multiple infections because they look very positive in a number of organisms, or is there cross reactions, or is there both happening, do you think, in the Mexican situation?
Yes, that's a possibility. Nevertheless, it has been proven that Tick-Plex is very specific, and that we have. I don't have the data here, but it is published, and we could go over there if you want. But it is there is a good body of evidence about that.
So the rickettsia that you're testing for over there, because it sounds to me that you need an urgent, very accurate test for rickettsiosis. The rickettsia testing in Tick-Plex is definitely picking up the rickettsias you have in Mexico.
Well, that's something that we want to really understand, that that's something that we are really just starting to investigate on that. But as I told you, there's a bunch of evidence that it is specific and it might be accurate.
Yes, thank you.
No, thank you.
Cycling to Leon's point about the tick percentage of infected ticks. Is that collected from the field?
Yeah. Yes. Yeah, most of them were collected in the northern states of the country, and we have positivity for over 10% of them. Yeah. Yeah, so we have a lot of hot spots over there, which are not just being seen by anybody. Yes. For example, this group reported they were picking up from 3%. They were picking ticks in just one northern state of the country, which is Tamaulipas. It's also in the border with with USA in the Atlantic side, and they found 3% positive animals just for Borrelia burgdorferi, just for that. Sorry, and 20% of the adults. Yeah, sorry, I did. Yeah. Yes.